My name is Petr Torak, MBE, and I'm the CEO of Compass Charity based in Peterborough in the United Kingdom. Compass Charity is one of the partners of a project called Roma Plays Age, and I would like to introduce this project to you now and all the work that we have done so far alongside with our partners and organizers from the Heriot-Watt University. So the presentation will be on the topic of aging on the margins, social and cultural perspectives on aging among Roma communities in the UK. So it is well-known fact that Roma people face inequalities in various areas of life, whether it's health, housing, employment, civic participations, and many other areas of life. The study explores aging through the right to the city lens, right to participation, and also right to appropriation, because these are two different things. The frameworks like age-friendly cities often overlook marginalized groups, such as the Roma community, and therefore the special or specific focus on the Romani communities living in the United Kingdom. So first of all, I would like to introduce the Roma Plays Age project. So this project is funded by UKRI, AHRC, and the timeline for the project is between 2024 and 2027. We have got 3 different sites within this project: Gavin in Scotland, Luton, and Peterborough in England. This project is very unique in one thing, and it is that it's very much community-led project. The project is led by the Heriot-Watt University, but there are lots of other partners, and especially community partners in this project, supporting the structure and the outcomes and the delivery of this project. Amongst the Compass Charity, there are also organizations such as Luton Roma Trust, there is the Roma Support Group, Anglian Rescue University, Coventry University, and also the Community Renewal Trust. The community-based participatory research involves 27 Roma co-researchers, specially trained in terms of obtaining relevant information, conducting semi-structured interviews, photo diary interviews, and other forms of interviews. They are also trained into specific ways of obtaining GDPR-sensitive data and many other topics. So far we have got then 27 co-researchers trained in this project from Czech Republic, Slovakia, Romania, and some other backgrounds and groups within the Roma community. And there are 4 work packages, each package focusing on a different kind of phase of this project, from interviews, semi-structured interviews, and then photo diary interviews or walk-along interviews. So far, the preliminary findings from the work package 1 and work package 2 include interviews, 79 semi-structured interviews, 57 go-alongs interviews, and 33 photo elicitation interviews. We have done also knowledge cafes and other community meetings to capture very important data from participants over the age of 40. So let's look at navigating urban spaces. So all the Roma face insecurity in public space. If you don't know a language, when you come to a new country, if you don't know anyone in that new country, if you previously experienced a hatred, discrimination, marginalization, you feel insecure, very obviously. There's also stigma and fear, limited mobility. You kind of don't tend to go further, like you don't tend to explore all the places because of the fear and the stigma. And as you probably know, Roma communities across the Europe, they carry this stigma of being because of being a Roma. There are also gender-specific exclusions, restrictions on women's independence, not obviously only because they are Roma, but also because being a woman in a specific culture carries also certain restrictions. And there are lack of safe, inclusive, and fair kind of spaces. Very often we hear from the participants about lack of spaces where they can go to and feel safe because maybe bad lighting, maybe because of people looking at them in different ways, maybe because of generally lack of those facilities that welcome Roma members of the communities. There are also healthcare barriers when it comes to Roma people over the age of 40. Healthcare experienced as a struggle, not a right. For anyone living in the UK, if you don't speak English, with now the digitalization of all the systems, including the health system, it is a struggle to book an appointment with your local GP, with your doctor. But if you are from a community where you've been marginalized and not able to participate, it's even more difficult. So Roma people over the age of 40 very often experience the struggles to book an appointment with a GP, to be seen, to be heard. There's also discrimination and language barriers and long waits. Many participants actually reported that quite often the healthcare assistants or people at the receptions quite often will bring their own prejudices from back from their countries, because those receptionists quite often are people from Poland, Lithuania, Czech Republic, Slovakia, Hungary, Romania, and many of those that are not Roma will bring their prejudices and portray those prejudices towards the Roma patients. There's a reliance on young family members. So we see many Roma families taking their children to a GP appointments or to hospital appointments and then using them for a translation. This obviously causes also a problem because if you take your child away from school, then you will face a penalty for your child not being at school. The child can be actually expelled from the school because of the poor attendance. But also there's another struggle, and that is the reluctance to speak about certain topics in front of your child. Very often we see women not disclosing very important information to their GPs because they are embarrassed to talk about women's health in front of their children. And there's also stigma around mental health. It's within many communities, including the Roma community, mental health is still seen as a stigma, very similar to a disability. And many people will not talk about those things with the GP because of their perceptions, but also because of their own stereotypes of how things are seen in the UK. And here is a few quotes from people that we have spoken to. We are not treated as people, like we are not worth it. How can it be? For us, Roma, it's hard because we don't know the books. We don't know when we get old. We only think about death. We feel that no one helps us. This was a male, 45 years old in Govanhill. Or another participant said, I have a lot of problems with my legs, and every time I visit the doctor, they said that I don't have anything wrong, and they have told me to go to work. They only look at me physically. I don't look ill, but my legs are hurting me because I have 13 kids. I have been working a lot, and I have an age. I'm 49 years old and I cannot work. And I have left crying. They told me to go and lose weight if I want to be healthy. They say that I am too fat. What I can say to someone like that if I make a complaint about it? The other area of interest is housing. Many Roma people within the community report very poor conditions, overcrowding, and housing insecurity. There's very often also fear of eviction and the rights to not be kicked out or to be evicted from your house. Very often Roma people tend to rent houses from private landlords, and to some degree they are often also exploited by the private landlords in terms of overcharging them for various things, evicting them for no reason, and not looking after the houses the way that landlords should. There's very limited social housing and also lack of age-appropriate adaptations. Many Roma that are of the age of 60 plus, 70 plus, very often live in houses, not only overcrowded houses, but also houses where they have to climb the stairs, even though they have got a reduced mobility. There are no handles in the bathrooms and so on. And another topic of our interest was multi-generational interdependence. As I've mentioned, many Roma people live in multi-generational families, in multi-occupancy houses, and very often they are dependent on the younger generations, on their children, on their grandchildren, and so on. Strong family ties provide support, but also constraint. Older people feel squeezed and lack out of autonomy. And women carry disproportionate burdens of care. And this includes not only women as wives or daughters, but very often even grandchildren looking after their grandparents. The other topic is loneliness and social disconnection. Despite the busy life, loneliness persists. Limited culturally appropriate activities are still an issue. We are not talking only about any activities, but culture appropriate activities are very limited or very often missing. The clashes with caring responsibilities, that's another issue. If quite often mothers will struggle to leave the house because of the responsibilities, whether it is house care, whether it's child care, and so on. And physical and health barriers to participation. And here are some of the quotes. I cannot go anywhere because I have 2 daughters and 4 nephews. Now I locked myself in and I found my way to God. And that's how I have solved my problems. This was a mail from Governor Hill. And very often it's the age and the health that stops people from participating because there are not appropriate activities in place in their cities. And also the voice and participation are another issues. All the Roma are excluded from civic decisions making. Tokenistic processes, language barriers and mistrust, and desire for meaningful consultation and representation. When we think of Roma people over the age of 40, quite often they were very active in their communities back in their home countries. They were politically active, they were active in their communities, and they were also involved in various different ways. But now, living in a country where they can't speak English, and for people over the age of 40, it's not as easy to learn the language as for somebody younger. So, yeah, and also not knowing the system, not knowing the country, not knowing many people around, all those factors disable people from taking active participation in the place where they live. And they quite often feel excluded because of this. They are feeling that they have no voice, that they cannot influence the decision making in their cities. They would love to take part, for example, in council meetings or meeting their MPs, but they can't do this because of the limitations. And here are a couple of quotes. They don't understand me. no one understands me. I want to be able to, with this interview that you are taking and you are recording me, maybe there as those offices and so on, maybe it will help us in consideration. Maybe it will help us. What this man means is to be heard, that throughout this interview he talks about the lack of facilities and opportunities to be expressed and to be heard, and he's hoping that through this project we'll be able to change things in his city and to influence decision makers to actually involve Roma in active participation. To conclude this presentation, findings reveal significant barriers to aging well in place, including navigating home and community responsibilities, opportunities for social participation, feelings of belonging, and attachment to outdoor spaces, and issues of respect and inclusion in health and social care settings. We reflect on some of the ways space is highly gendered in old age within Roma communities, including issues of safety and security, balancing caregiving roles in mid to later life, and visibility within public space. The implications. The paper contributes to a more inclusive and context-sensitive understanding of aging in a place, offering critical insights into how ethnicity, gender, and spatial inequalities shape experiences for Roma people as they age. It concludes by offering recommendations for urban policy, planning, and aging frameworks, particularly by age-friendly cities and communities' agenda, to better reflect the lived realities of Roma communities. In doing so, the paper highlights the importance of designing and governing urban environments in ways that recognize diversity in aging and promote dignity, belonging, and inclusion for all. If there are any questions, we'll be more than happy to answer your questions. You can contact us by the emails below. There's an email for Aleksandar Marinov and Ryan Woolrych. They are the lead on this project from the Heriot-Watt University. You can also contact me by email and we'll be more than happy to answer any questions. The QR code will take you to the website where we are putting all those information about the project so far. We are midway through the project, and it's absolutely delight for us as a community organization, as a charity based in Peterborough, to be part of such a wonderful and very unique project. I say unique because I really see this project very unique in a way of including the community, not only by recruiting community co-researchers from within the community, then reaching out into those communities and facilitating the discussion in various different ways, not only by semi-structured interviews, but also by the photo diary interviews, go-along interviews, community meetings and cafes, and so on. So it's very unique, very important research and project, and we are very proud to be part of this. Thank you very much for your attention, and if you've got any questions, get in touch. Goodbye.